Dear viewers, Assalamu alaikum. Welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. We mourn and pray for the COVID victim all around the world, especially in the subcontinent. Dear viewers, today our topic is experiences of Ilizarov around the world. As because of we are using Ilizarov for various purposes in the different part of the world. And we want to show two things from two parts of the world, one part from India and one part from Russia, the experiences of Ilizarov. So I would like to request two of our speakers, Professor Novikov sir from Kurgan, Russia. Good afternoon and welcome, sir, to our show.
Good afternoon, all of them.
And another speaker is Dr. Shamsul Hoda from Patna, India. I would like to request Dr. Shamsul Hoda sir to join with us. Welcome, sir, to our show OSA.
Thank you and good afternoon, Dr. Tanvir.
Thank you very much. Dear viewers, we have two learned academic experts. One is the pioneer Ilizarov surgeon and the magnificent presenter, Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Okay, thank you, Tanvir. Wa alaikum assalam.
Welcome, sir. Welcome to our show. And the second one is the very prestigious, the President of Bangladesh Orthopaedic Society and the Secretary of Assami, Professor Abdul Ghani Mollah, sir, as the Director of National Institute of Traumatology. Sir, assalamu alaikum. Welcome to our show, OSA. Thank you very much for joining. Dear viewers, we have lots of experiences regarding Ilizarov. Among them, only two will be shared in this session, one from Patna, India and one from Kurgan, Russia. I think it will be helpful to you. Now, I'd like to request our first presenter, Professor Novikov, sir, to present his excellent presentation. Professor Novikov, sir, please share your screen with us.
Can I start? Yeah.
Yes, sir. Please share your screen with us.
You can see? And
yeah, so we can,
let me
we can see your
say
screen.
A few words about our father, about our teacher, about Ilizarov. This year we will celebrate century of Ilizarov birth, 70 years of Ilizarov methods, and 50 years of Kurgan Ilizarov Center. And from beginning, I want to say, what is it, Ilizarov methods? I not talk about device, Ilizarov apparatus, because so many different external fixator use Ilizarov methods. Ilizarov methods is bloodless and low invasive surgery. Very important, very strong fixation of bone fragments. More than important, this is principle, early weight bearing on the affected limb. Very early function of adjustment joint and postoperative adjustment of the bone fragments from the time surgery till the removal of frame. And when we talk about apparatus, about methods, one doctor from France many years ago says this frame provides happy balance between elasticity and stability, and its biomechanical factors adapted to bone allow to achieve amazing recovery. What does it mean? Ilizarov methods, this is not is apparatus. This is not is methods of treatment. This is some condition of our body, or all of tissues. And many years ago, Ilizarov opened very interesting effect, open for us not only possibilities, open the door for the future, for the forces. Experimentally and clinically, a previously unknown general biological property of tissue has been established to respond to moderate stresses arising in them, mainly tension stresses, by growth and regeneration due to the stimulation of biosynthesis processes in tissues. This is Ilizarov effect. Let me few minutes show this picture. This is Dr. Genius, our father, our teacher, friend, politic, coach, and I want on this presentation show some complex use of various modern methods of wound treatment, allow expanding the possibilities of providing care to patients with problematic defect and improving their quality of life. And I want to present several clinical examples of patients with problematic defect will be demonstrated as an illustration of the possibilities of using negative pressure wound therapy. And sometimes we use Ilizarov apparatus for treatment severe and wound without fracture, but this is patient with bumper open fracture on the bone. Very easy and very quickly we support with external fixator, but how we can help with wound? Because usually doctor spend so many time and big different technique for solve this problem. With Ilizarov methods, with Ilizarov effect, we have another possibilities when we can invite for support us, for example, plastic surgeon, skin surgeon, and can collaborate with plastic surgeon, because without external fixator, very difficult to close all of this wound. And during the treatment in the hand of plastic surgeon, patient continued work and patient continued use of lower extremities. And you can see how step by step we start close this deep and severe wound. Because plastic surgeon not use external fixator and traumatologist cannot use technique from the plastic surgeon. When we collaborate shoulder to shoulder, we can get fantastic, excellent result and multiplied effect from the treatment. And you can see finally, after a few months, patient before treatment, some doctor recommend amputate this leg, and now patient can continue to use normal shoes and walk without any support. Gunshot wound to the leg with damage of the right knee joint and vascular complications in the left tibia. Severe problem. And external fixator give us safe and give us create good position for all of tissues on the extremities. For example, how we can treat without external fixator? Very difficult. And how we can treat without plastic surgeon? Very difficult. Together, we can get fantastic result. And now, after finish of treatment of this skin, we will correct of his axis of lower extremities. In other situation, very difficult, and many doctors try closed and having skin, enough skin for cover of this very deep wound. You can see calcaneus, and so many years patients spent in the different hospitals without normal optimal result. And patient has only wound, and external fixator give possibilities take normal skin from another side during a few weeks spent in the band, but on the final we cover of this bad wound. And maybe this is a crazy situation when doctor apply external fixator for treatment soft tissue problem. In other case, patient with traffic accident, severe brain injury, close fracture of the neck, right shoulder, intra-articular fracture of the ulnar, incomplete separation of the left tibia in the level third, with subcompressions of the blood circulation, traumatic shock, severe case. And in the admission department, some doctor think about amputation because of so many soft tissue problems. Bone problem we can support with any treatment, with plate, with plaster cast, with external fixator, but soft tissue problem, how we can support? You can see which kind of damage of all of them. And here, external fixator and Ilizarov methods and Ilizarov effect create some forces from all of tissues, skin, muscles, nerves, when start regeneration, not on the bone, all of tissues. This is effect of Ilizarov. And now Ilizarov frame treat all of segment, not only bone. And doctor go to the shortening, remove near 8 centimeters. On the finally, step by step, with external fixator, give chance for close the wound. And then, after this stage, very easy lengthening by Ilizarov technique, and not only safe, but this is guy back to the normal life, and just now he's sportsman. Fantastic. Imagine situation from situation when doctor think about amputation till moment when he get silver medal. Our topic, Ilizarov magic from all of the world. I want to present case from another city of Russia, from Chelyabinsk. This is very terrible cases. Traffic accident, 1 year, 9 months old baby suffered on the traffic, and so many damages on the lower extremities, right extremities, crushing of the soft tissue in the right femur, open fracture and tibial, femoral and tibial, rupture of femoral artery, vein, sciatic nerves, closed fracture of left femur, and doctor try from simple external fixator from Ilizarov apparatus. Angiosurgeon, neurosurgeon, and surgeon, traumatologist, all of them talk and recommend amputate. One doctor who use, because how we can support not for bone, for soft tissue. One doctor who work many years in Ilizarov Center, just now he live in Chelyabinsk. He try support for this baby with Ilizarov frame, only for fixation and thinking what will be after a few days. After a few days, coming formation of soft tissue necrosis, and just now coming another situation, generally condition and pediatric and surgeon recommend amputate in upper part of the femur of this leg, because how we can support for soft tissue, not for bone, because all of this terrible condition increase. You can see necrotic area just now go down on the foot, swollen, edema, having pulse, having sensitive. Another solution, please amputate, because must think about life and about baby. Lost extremities, but save baby. And plastic surgeon from our center start support, remove all of necrotic tissues, and you can see external fixator give possibilities to treat problem of soft tissue. Each day doctor think about amputation. Each day haven't result with soft tissue, but step by step got Allah support and Ilizarov effect support. And you can see how very slowly but life back to the body of this baby. During the treatment, doctor not think about bones. First, they think about condition of soft tissue. So many surgeries and transplantation for cover the wound. And then coming time for negative pressure. And after that, how we can cover? Again come possibilities from Ilizarov methods and Ilizarov effect. Doctor took healthy soft tissue flap from left side and bring and cover deep wound on the left tibia. How we can treat without Ilizarov? We cannot. And now you can see collaboration between traumatologist and plastic surgeon. And step by step, team of doctors go away from deepest problems. More than 20 centimeters open wound, open the bone. On the finally you can see final result. And X-ray I won't show maybe next time, maybe another presentation, because this story was 4 years ago. After that, doctor from Chelyabinsk sent this baby for us, and now we already twice correct deformities, make lengthening, and in the Chelyabinsk 32 operations is done. More than 10 liters of blood infusion during 75 days. And Ilizarov apparatus and Ilizarov methods and Ilizarov effects give us possibilities, improved the quality of life of patients. Ilizarov simply taught us to drive orthopedic the car. This I took from Professor Bari, unique person, planet in the sky, airport in Kurgan, street in Kurgan, center in Kurgan has name of Ilizarov. This of friends of Ilizarov from all of the world must go to the temple of Ilizarov. And I invite you to cooperate, exchange your experience for all of our patients. Thank you very much for your attention, and I think the next presentation will too very interesting.
Thank you very much, sir. Thank you very much for your excellent presentation. We can do whatever we want by the help of Ilizarov and by the help of the plastic surgeons. It's a teamwork, and we can make impossible to possible with the help of Ilizarov. And now I would like to request Dr. Shamsul sir from Patna, India, to share his experience regarding the Ilizarov. Dr. Shamsul sir, would you please share your screen with us?
Thank you, Dr. Tanvir. Can you see my screen? Is it full screen?
Yeah, we can see your screen. Yeah, in full screen. We can hear you loudly and clearly.
Thank you, Dr. Tanvir. I would like to thank our mentors here, Professor Mofakhkharul Bari sir, Professor Novikov sir, Professor Ghani sir. Special thanks to Dr. Tanvir and Raj TV for giving me this platform to speak on Ilizarov techniques. My today's talk is my experience with Ilizarov cases at my clinic. So normally we get these all regular cases at my clinic in my Ilizarov clinic: compound trauma, bone infection, bone transport, deformity, and limb discrepancy cases. So I'll be going through each one of or two cases each in short, seeing the matter of time. So in any orthopedic trauma, we just classify the trauma and see and decide whether to go for a nailing or plating upon based on Gastilo's type 1 classification. So normally in type 3 BLC, we go for Ilizarov. I always keep my Ilizarov armamentarium with me, so I feel like an avenger always. I'm safe and can see the leg. Starting with the simple cases of Ilizarov trauma, distal humerus fracture, bone is exposed, it is infected, so we cannot do a plate or nailing in this case. So did a thorough lavage in this case. Reduced the fracture with olive wires and then applied Ilizarov ring over it. In 3 months, it healed very well. You can see the results. Full flexion extension was possible. Full movement post-op after removal of the ring was good. Another case, similar case, distal and humerus case, badly infected, Ilizarov ring was applied. It also healed well within 3 months. Soft tissue handling. This is another case of forearm fracture comminuted with a compartment syndrome where a fasciotomy was done. Nailing or plating was not possible here in this case, so I applied Ilizarov rings here, and skin grafting was also done in this case. You can see the bone is healing well, and this will be removed in another 1 or 2 months. Radius is almost united unless in the process of healing. The hand ring has been removed now. This is another interesting case. Normally, for use of VAC over Ilizarov is very difficult and it's cumbersome. We don't do usually. Studied in this case. This was a case of infected nail tibia proximal. Patient was in bed for around 6 months with dribbling pus, doing dressings and dressing with a stiff knee and equinus of the foot. So did the thorough department of the case. Normally, what we do, we remove the dead bone from here and do bone transport. But it takes around 1 and 1.5 years. So I tried a different way. I debrided the bone, docked it well with Ilizarov, corrected the equinus in this case, and patient was made to walk next day. Patient was so happy because he was in bed for the last 6 months, and she climbed the stairs of the hospital, 3 stairs, and went to floor. And his confidence could have been seen. Some bone was visible here, so I applied VAC. Progressive VAC was done, so wound healed with time, step by step. And last, just a small amount of skin graft was used. So you can see in just 6 months, it is completely healed and the ring was removed. Complete healing was there. And so with this, we could save time. VAC is cumbersome. We cannot do in all the cases, but in some cases we can do, because then the patient can walk free without any limb. All the movements are free and good in this case. Next, the cases of bone transport with Ilizarov for infection and trauma. The advantages are high rate of success, good restoration of length alignment, no donor side morbidity, patient mobilizes during treatment, limb salvage is always there. There are few disadvantages like long duration, malalignment, infection, refracture, wire loss or break, edema, neurovascular injury, pain, joint stiffness, long learning curve. But if you're expert, you have got good learning, good knowledge, you escape all this complication. So always follow biomechanical principles in Ilizarov. So this case is of bone transport for proximal tibia bone loss. You can see bad injury, the bone was exposed. So patient came to me 3 months post-injury with a stiff knee and equinus of the ankle. The bone was exposed. So I removed the dead bone from here. put on Ilizarov, corrected the equinus, and did bone transport from distal to proximal. With time, the wound healed very well. You can see the X-rays in the bone transport. Now the ring has been removed. The bone has united very well, and the patient is on the plaster cast now for another 1 month, and then we'll apply the bone, the brace of the patient. So with bone transfer, you can get very good result. Hope his life there. Second case is another interesting case, long bone transport for around 6 inches of bone loss. Patient came to me far away from Rajasthan. You can see loose bone fragment just held with one pin, and a lot of dribbling pus was there. He came to me and just asked, remove my leg, I want amputation. I requested to the patient, give me a chance, we'll try. So just remove the loose fragment, as you can see here, did a thorough debridement, did two level of corticotomy and trifocal bone transport. With time, you can see the wound has been healing well. As transport is done, the skin grows itself. While docking, I felt a part of soft tissue interposition at the docking side. So I did a soft tissue release from there and did a docking the side. So this is the progressive X-rays from beginning to end till now. The bone is being consolidated well. It will be there for another 6 months for a good consolidate to come. But I can see a good result here. There was a translation because I didn't apply a guide wire, as Bari sir always says. So I corrected the translation in the OT. So these are the result. Patient walked after 6 months. The first day post-op, he was so happy with his kid and family. This is 1 month, 3 months at his home, 4 months walking at his home, 6 months walking the streets freely, 8 months climbing stairs, and 1 year now he can do all his household works, activities of daily living. He's go to his shop and ready for another 6 months for a good consolidate and ring removal. So we have to give the principle of Ilizarov with this. This is another very interesting case of a very bad crush injury in a young girl. So this was a case. This is a very bad crush injury. The girl was run over by a tractor. You can see a bad pelvic fracture and a badly injured thigh, and was amputated at the level of knee. So when she came to me, she pleaded to me, "Sir, I want suicide." She was in extreme depression. And then that day I promised that if God helps, we won't let you die. And then I started her totally free treatment. We did a lot of hard work with her, did thorough debridement, and skin graft was applied. Excuse was there for some time, and tense was also there for some time. But we could see non-union and pus dribbling from the upper part of thigh. So the excuse was removed and LRS was applied. Still, the bone could not unite well. The pus was still dribbling. So we then switched over to the gold standard, Ilizarov, removed the internal flexion of the tens because the source of infection, did 3 cycles of piano accordion method, and bone has finally united very well. And the very good news was, in the wean period, the patient got married with the Ilizarov on his leg. She was so happy. And I was really feeling blessed with the patient. So this is another case, a short case of bone transport with knee contracture. Ilizarov was applied for correction of knee. Knee has been corrected well. The bone transport has been done. It is consolidating. So we can apply Ilizarov for all the things at once. This is another case of bone transport for infected nail. Dead bone removed. Bone transport done. The bone is consolidated well now. The ring has been removed in this case. In the trauma cases, when we don't want to remove the bone, when the bone is exposed, so how do we handle the soft tissue? As sir said, we can apply VAC, we can apply flap. So in this case, I put on Ilizarov rings, made the patient walk, wait for another 2 weeks, and then seen that the wound was healing, the ring was surviving. So then I removed the mid-ring wires, put on a flap, and then I reapplied fresh wires on the ring. Now it has been very well. So VAC or flap can be done very well. Soft tissue handling, if treated very well as a teamwork. This is another short case of orthopedic trauma, proximal tibia fracture, where a minimal ring was applied. We used the olive oils to reduce the fracture. Patient could wash next day, and in another 3 months the ring was removed with full flexion of the knee. Another case of distal femur infected tibia plate, femur plate with loss of pus was coming. Ilizarov ring was applied. Patient walked next day. Bone healed quite well, and the ring has been removed now. I'll put something. Yeah. This is this was I showed the last time. This is use of minimalistic Ilizarov ring with just 1.5 ring for volar button fracture and few wires. You can see the beauty of reduction in this case. We don't need to open up and put a plate in these cases. So just in 2 months, healed very well. You can see the reduction. You can see the union. You can see the patient, the movement is doing all the movements. So with Ilizarov, we can do anything in all the cases. This is another example of minimal Ilizarov ring fixator in a calcaneum fracture. So in this case, I used just 2 half rings with a modified Kirpat dynamic frame technique. Patient can walk, partial load bearing, third day, do all the dynamic movements. So these dynamic movements reduce the fracture as well. And you can see a very good healing case. Patient can squat for toilet and all, and patient can do heel raise also. So active rehab is very important in all the cases to get very good movements of the joints. So now we'll come to the third part that I do is the Ilizarov and deformity. I'm just showing the few cases of deformity in here. Just a glimpse. So the first case is adolescent clubfoot deformity, 18 years female. She was worried for marriage that if with this deformity cannot be married, get married. And I could see a bony deformity. There was a flat top talus in this case. So these are the components of deformity. I planned a V-ostomy in this case. This was planned in this case. Did a V-ostomy and Ilizarov ring was applied. Gradual correction was done. This is the final result, complete correction of the foot. From this to this. Another simple example of cubitus varus, not going to the typical French ostomy. I did a correction with Ilizarov rings. You can see the movements, active movements with Ilizarov. No stiffness of the joint is there. You can see the complete healing, complete movements, complete correction with Ilizarov and cubitus varus. Another very interesting case is this case of post-traumatic, post-plating infected deformity of the proximal oblique plane deformity. In this case, I always do a scanogram in all the cases of deformity and limb lending. So this is a thing I recommend to all the young surgeons. I do all the corrections of angulations, all the calculations on Bone Ninja app that I got from Baltimore, from the deformity course. So I did all the calculations, what I have to correct, how much deformity I have to correct. So these cards I always keep with me for deformity correction. This formula of map the ABC, I always follow the Baltimore method. I won't go into details now. This was the virtual correction plan done. If I applied a nail, there would have been shortening. I can then apply a Ilizarov. But in this case, I plan to do an OrthoTV with software help. You can see the patient can walk next day. It's very comfortable implant. After deformity correction, I just did the debulking and applied LRS. And another 6 months, this was removed. You can see there's no limb. The LRS has been removed. So this is another example of using OrthoTV or head support in a case of deformity or limb lengthening. This is another case that I've just done. Lengthening of a nail and polio cases. You can see the limb in this case, the shorting in this case. I didn't apply simple Ilizarov. I applied nail over Ilizarov long. So the distal part has been locked. The proximal part has been left. The transport has been done. Now the patient can walk without any limb. So just after COVID, the ring will be removed and proximal screws will be locked. So with this, the long duration of Ilizarov around 1 year can be saved just to 2.5 months. This is another example of pediatric deformity due to vasculitis of tibia ankle varus deformity with toe shortening. I corrected with Ilizarov and distractor for the toes. So rule for all the deformity corrections, do a scanogram, a full-length X-ray, measure the deformity parameters. In all the cases, pre-planned deformity, I do virtual planning on Bone Ninja in all the cases. I always keep my armamentarium in my OT. These are the next few cases I have to do, hemimelia, plan to do after COVID. So these are the few post-op results. If you do well, follow the principle, follow your mentors. You can get very good results in all the cases. Patient walking in village comfortably with the rings on. So putting a ring is never cumbersome. You've done well. Patient can comfortably do all his works, do all his activities, do a job, go to school, go to college. So the hashtag for today is Ilizarov saving limbs and hope is life. This is my short Ilizarov family with me. Happy family. These are my Ilizarov mentors with whom I have learned Ilizarov. I've come to this place and the learning curve is long. Thank you. Thank you, sir.
Thank you very much, Dr. Shamsul sir, for your excellent presentation. I think our Orthopaedic Solution Academy will be the virtual museum of Ilizarov, and we can collect many things, many examples, and many cases from this Orthopaedic Solution Academy. Thank you very much. Thank you very much, Professor Novikov sir and Dr. Shamsul sir, for your excellent presentation and cooperation with us. Now, I would like to request Professor Mofakhkharul Bari sir to share his experience regarding our two speakers' presentation. Professor Mofakhkharul Bari sir,
Can you hear me?
could you please share your experience? Yes, sir, we can hear you, sir.
Can you hear me?
Yes, sir, we can hear you. Yes, sir, we can hear you, sir.
Can you hear me?
Yes, sir.
Thank you very much, both the speaker. Well done. Well done. Now you can hear me?
Yes.
Yes, sir, we can hear you,
yes.
sir.
Well done. Okay, well done. Both the speakers presented very nicely. First, I would like to draw the attention regarding the presentation of Professor Novikov. And he nicely mentioned everything, you know, whenever you are doing any very bad case with soft tissue injury, he told regarding the Ilizarov, three things. Ilizarov, one is apparatus, regarding is the method, second is the method, and third one is the effect of the Ilizarov apparatus. And NPWT, role of VAC, both the speakers, they have shown the role of VAC. So the one case of the Novikov child, very badly affected, and it could be managed only by the help of the orthopedic, vascular surgeon, plastic surgeon, and with Ilizarov, not orthopedic, Ilizarov surgeon. And that was nicely he mentioned and he showed. Thank you very much, Novikov, for showing us a very beautiful, a very bad case. And regarding the varieties of cases shown by Dr. Shamsul, nicely mentioned everything. Thank you very much. And one thing only I would like to draw your attention regarding the hand. Whenever you have put the hinges, two hinges with, in between the hinges, you have put the rod, and that rod is bad. And probably, I think it would be better if you could put the hinges instead of the rods in the hand for correcting of the deformity in the hand. Otherwise, he explained and showed very beautiful cases, very bad cases, and only if you have Ilizarov technique, if you have Ilizarov knowledge, you can manage these kinds of difficult and complex trauma and complex deformities. Thank you very much, both of you, Shamsul and Professor Novikov.
Thank you, sir.
Thank you very much, sir. Thank you, Professor Mofakhkharul Bari, sir, for your speech. Now, I would like to request Professor Ghani sir to share his experience regarding the presentation of for both speakers.
Thank you. Tanvir.
Yes, sir, we can hear you, sir.
Thank you very much, all the reverend speakers, particularly Dr. Novikov and Dr. Shamsul, and the panelist, our mentor of Ilizarov. So, for last 2 to 3 weeks, we can share our experience regarding Ilizarov cases and discussion is very, very nicely. These two speakers, they are presented in their respective sites, are very nice. But I want to mention some points to Dr. Novikov. your first case is the heel open the heel, owned heel. So you do it by cross-leg flap by the help of the plastic surgeons and with the application of Ilizarov. What I can do, because there is a long anterior and posterior skin and flap coverage possibilities are there, so I can do the sural island flap or extended sural island flap or flap delay method that you can cover your heel easily. You can cover not only your heel, you can cover the anterior part, posterior part, lateral or medial part of the ankle, and mid tarsal up to the mid tarsal bone of the foot. So this is also a very good system. What Novikov has done. In this regard, I want to say, last lecture, I mentioned that orthopedic surgeons can do some flaps, common flaps, particularly in the lower limb flaps. That Professor Bari sir says, Professor Bari says, no, we are learning in United States, particularly in the Los Angeles and San Francisco, in the Sign Conference of America. There, some common flaps are very much important for the orthopedic surgeons. So, cross-leg flap is not the bad one, but always you are dependent on the plastic surgeon. And that's why I established the super specialty of the reconstructive unit. Instead the establishment of a plastic surgery in our hospital, in our institute, another reconstructive unit is there. So that our orthopedic doctors are interested to do some common flaps and coverage of the heel, coverage of the middle leg, and coverage of the upper leg, and coverage of the knee also. But what Novikov has done, that is excellent, very excellent, undoubtedly. With the help of the plastic surgeon, with the help of the vascular surgeons, he has done a lot. One bad cases he has said, that is the case of replantation. I think there is gastro-3C. That case was gastro-3C. Yes, a orthopedic surgeon cannot be all surgeons. He cannot be a vascular surgeon. He cannot be a good plastic surgeon also. And that's why, in that case, vascular surgery is very much important for the orthopedic surgeons also. In that case, I thank Dr. Novikov that with the help of the vascular surgeon and plastic surgeon, you do the replantation and save the limb. It is very excellent, undoubtedly, and I appreciate you for your good. But in this regard, always I request all the doctors, all the orthopedic surgeons particularly, know some common flaps. Regarding Shamsul, Bihar, he is a very enthusiastic guy and doing good Ilizarov, and he has shown all the compounds, all the complex use of Ilizarov in everywhere. Upper limb, lower limb, arm, forearm, infected non-union, gap non-union. Fantastically, he bone transport, he has, and bone deformity also. So I think you go ahead and try to do. I think you never use any flap. I request you, because you are young guy still now, you just know some common flaps. Then it is very possible, very much possible to save the limb. If there is the vascular injury, it will be very much easy for you to save the limb. Regarding the bone transport, perhaps your one bone is 6 or 7 inch, I think. So 6 and 7, if there is a proximal end 2 to 3 inches and distal end 2 to 3 inches, it is very easy to bone transport from bifocal corticotomy, or if needed the trifocal corticotomy after 1 year, it is possible. There is another chapter that Professor Bari sir was used, that the transfer of fibula. If there is a good fibula, transfer of fibula and tibialization of the fibula once over a time, and with the application of the Ilizarov. That is also a good plan, but I never do it. I always use your plan, that is the bone transfer from proximal and the distal. That Professor Bari sir is also doing that in before, long before. So your presentation was very nice and said, and I am very much fond of infective non-union. It is my hobby. It is my pleasure to save the limb, and I always try to test my students, educate my students that they are doing some common flaps and save the salvage of the limb. Otherwise, there is no option. There is no answer. Why there is no answer? There is a application of Ilizarov, and that is why both the speakers and the panelist, our mentor, our Ilizarov man in Bangladesh, not only in Bangladesh, in the subcontinent, not in subcontinent, but in the world also, in United States, because he was the visiting professor of Kurgan. Not only he was the visiting professor of Bari in Bangladesh, he was the visiting professor of Kurgan. With the help of Professor Bari, sir, many young surgeons are interested to come forward and going do like that type of injury. So in this occasion, I appreciate all of you, and when I have take a time, maybe next lecture, I will say something regarding Ilizarov. So in this occasion, I appreciate you, and very much thanks for your patient hearing. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you for your excellent speech. You encourage us always, and you gave us a scope to build ourselves in the reconstructive sector as well as in the Ilizarov sector. And I would like to thank all of our participants today, especially our speakers and our honorable academic experts for being with us. And I'd like to thank Raj TV for helping us by doing such type of academic programs, and definitely Leonardo Pharmaceuticals Limited for sponsoring our program. I would like to thank all of our viewers, and please stay with us. I hope we'll see you in the next Friday with another topic, definitely with this magical Ilizarov. Till then, I'm Dr. Tanvir Ashraf saying bye-bye to you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe.